thank you, Johannes, and welcome everyone to Brighton, and thank you for making the effort to come here and participate in the meetings. And it's great, as Johannes said, to see so many people. Let me just give you a quick update from myself. Now, you have a report in your papers, and I'd obviously be happy to answer any questions about anything that comes up in that report you may have. But I don't really want to go through that because that would take an awful long time. So let me just pick out what I would say a few highlights over the last 12 months. It was literally on the eve of the 9th General Assembly in Hyderabad that we last met as the council, and I gave you that address then. And I was quite anxious at that time, as I think everybody was involved in that meeting. Was it going to be a success? Well, I think we all know now what a success it was. The feedback and from everybody who participated was overwhelmingly positive. We had more than 1,600 delegates. The level of the papers, the level of discussion, I think everybody really enjoyed. And it gave a tremendous boost and a momentum and a great uplifting, really, for IAPB and its work. And we'd like to thank everybody who was involved in making that such a success. And many of the supporters, the sponsors who made that and contributed to that work are here again today, which is great. Now, given the success of Hyderabad, we thought we would try and re-energise our council meetings. So this meeting in Brighton was described to me last night as a mini Hyderabad. And I think I quite like that, so I put that in this talk this morning. And funny enough, there's an Indian palace in Brighton, and I recommend you go there tomorrow night for the Site Savers reception around the neglected tropical disease meetings. But seriously, this meeting, we've tried to change the format and literally make it similar to, obviously we can't do another General Assembly every year, but we wanted to try and make this a much more engaging meeting. People could come and sort of learn about latest practice, good practice, share ideas, and all of yesterday's program, which I know many of you attended and were involved in, was designed for that. On Saturday, we had a fantastic meeting all day about diabetes. So we were trying to learn the lessons from the General Assembly in Hyderabad and really sort of repeat it on a slightly smaller scale at this council meeting. And I hope when we ask you to feed back to us how you felt about it, that some of that will come across as a good news. And it's something we'd like to do in future. Some real highlights and successes from the last year. Well, undoubtedly, the most exceptional success was the adoption of the new action plan at the World Health Assembly in May. So, as you all know, we've had various resolutions in the past, and we indeed had an action plan for 2913. But a huge amount of effort went into both the content and getting support from member states for the Global Action Plan. And I'd like to sort of say thank you for a fantastic job done by our WHO colleagues, who I think I saw sitting in the room. There you are, Sylvia and Ivo. Fantastic content. I think everybody who's read the plan is very, very, very pleased with the content. So thank you all for that. And as those of you who were involved in sort of going to both the World Health Assembly's meeting in May, but also the Executive Board meeting in January, across those two meetings, 33 countries spoke about the plan in a very positive way. So it was a huge success, and everyone was very, very pleased with the outcome. But the big challenge, of course, is what happens next? And implementation at country level I guess, is the most important focus of IAPB, trying to promote that going forward. And I want to talk about that at the very end. I'll come back to it. In the light of the new Global Action Plan adopted in May, IAPB has also been producing a new strategic framework for itself, and we're going to look at that in a moment. But the reason I've put these in juxtaposition is because our own IAPB plan is very much designed in the light of what's in the Global Action Plan, and supporting the implementation is the cornerstone of the new action plan for us as an organisation. I'm not going to say any more about that because there's a session in a minute about that which Richard Bennett will be leading. This is a really encouraging slide for all of those involved in supporting IAPB and its work. A couple of years ago, the only two logos on this chart would have really been Seeing is Believing and Zeiss. And over the last couple of years, we've been able to build up our partnership and relationships with a number of new corporate members and sponsors. So this, I'm not going to read them all out, but that's now all the people who are involved in supporting IAPB and its work. And we know that by next year, there will be even more on that. So the whole build-up and the relationship is fantastic. And our development team, our fundraising team led by Joanna, have been very active in this area. And the General Assembly was a great springboard for this, and we've built on it since. So that's very encouraging for our overall financial position. And when we get later into the agenda, you'll see that IAPB finances are in a reasonably healthy state. This time last year, we were a little concerned, but a year down the line, things have much improved. Now, this money has enabled us, and support has enabled us to do things, which is great. And I remember last year standing in front of you, somewhat embarrassed. There we were in Hyderabad, India, saying to you that we still can't find the resources to fund an IAPB regional coordinator, regional director for Southeast Asia, despite that region having the most numbers of people who are visually impaired in the world. So I'm glad to say that we have managed to find the money for that post, and we imagine that this person will be in post very shortly, certainly hopefully by the beginning of next year. And Dr. Das, the regional chair, and I were speaking earlier this week about how we would do that. So hopefully that is, if you remember, I said one of my key objectives was to strengthen the regions. Now, we've never said we want hundreds of staff at every region, but we do need some to push the agenda. And most of the other regions are benefiting from the collaborative efforts of our staff there and the regional chairs and others involved and our members. So this is a boost, I hope, to that region, and I'm very glad to be able to report that. The standard list has grown from strength to strength. I know you can't see the graph, but all it's trying to show is that I think we're now up to more than 650 users of the standard list, and 32 of the manufacturers have now signed an MOU with us, and that sort of outlines a number of advantageous things for our members and others, agreed prices, etc., for various pieces of equipment and drugs and consumables. So this is all good, and this is a very exciting and successful project, and over the next year, I think we're going to see a lot more progress and potential here. We've also established and re-established two very important work groups who we hope will take forward agendas around diabetic retinopathy. And as I've already mentioned, we had a meeting around this on Saturday. It was attended by the president of the International Diabetes Federation and many other prominent people in the world of diabetes control and screening programs. The group is chaired by Nick Kougialis, who is, I can see there. I don't know if you just want to wave a hand. And it was attended by 50 people. It was very vibrant and a very informative meeting. And there's lots of work to go forward on what we all know is one of the major emerging problems in the world of blindness and visual impairment. And I'm also pleased to report that we've re-established the refractive error work group. And again, just to remind everybody, refractive error, uncorrected refractive error, is still the major cause of visual impairment in the world. And these are the prevention of blindness and deafness figures, which showed that 42% of blind people and visually impaired people uncorrected refractive error. So we're really glad that this group has been reconstituted. It was very effective in the past, and we're re-energising it, and it will have a key role going forward to push that agenda. I just have a couple of slides to finish, and it's about the future. And we need you to help us, and we need you in two key areas. The first of it is around the post-2015 development agenda. Now, you all know that the global development paradigm over the last 15 years has been very much led by the 8 Millennium Development Goals. And basically, if your issue and the thing you were trying to promote was included in those MDGs, then you were certainly in a much more advantageous position than other causes which were not included in the MDGs. And of course, eye health didn't feature in this first rendition. So at the moment, there is a huge amount of consultation globally to influence the content of the next, what happens next. So the next agenda is 2015 to 2030, and there's a big meeting next week in the UN to take account of all the various consultations, ideas and inputs that have happened so far. And IAPB, along with us, partner organisations, the World Blind Union, the International Council for Education for Visually Impaired, many of our members, other networks that we're involved in have been engaged in making submissions to this. Some of the reports that have come out from groups like the High Level Panel and the WHO report on health had many very positive things in them. Messages that we were sending about universal health coverage, messages about the need to make sure that disability is across the whole agenda, that data is disaggregated so that we can record how much progress is being made for people with disabilities. This was all good news. So there was lots in some of these reports. But of course, as all this input is funneled down, when you get to the sort of the final outcome documents, everybody's message is diluted. So although there are still some quite positive references to disability and health in the documents that are going to the UN next week, certainly we'd like to see more. Now, following the meetings next week, it will then go into a sort of more typical UN system where country input will be really essential. And there's something called the Open Working Group, which is a number of countries in 30 clusters. And they are a key target for trying to get our messages and engagement in the health and disability, things that will be ultimately of benefit for eye health. So we have produced an information pack all about this. Some of our members are very engaged and involved in this already, but we would really like if other members could assist, particularly those that may have links to the countries who are engaged in this open working group process at the moment. So I think the briefing pack is on that table there, just as you go out. What would be really fantastic is if everybody could pick up a copy. Most of you have got long flights or at least a train journey on your way home. If you could spare 10 minutes to read it and to get back to either myself or my colleague Zoe Gray, Zoe, if you make our advocacy manager, and just let us know, look, I'm interested in helping. I think I might have some contacts with the people in my country who are involved in this process. We'd really like to hear from you and work together how we can send the right messages to the UN. And finally, I come back to the Global Action Plan. As I mentioned before, for us, we were very pleased with the new action plan, but the key challenge is making sure something now happens at country level. And there's been lots of discussions over the last few weeks and today at the Board of Trustees meeting. How do we actually drive something forward at country level? Because this is what success depends on. Unless countries do something about it, then it's not going to be as good as we hope. So there are a number of things we've talked about as ways of stimulating interest and action at national level, and all of them need your help. The first one is data and evidence. And rapid assessments of avoidable blindness are a proven tool which have many benefits. Not only do they tell you about the current situation in your country so that you can plan your programs better, you can do them again 5-7 years later and actually measure to see if you've had any impact from your work. The data feeds into the overall global estimates of prevalence of blindness and visual impairment. But equally important, it's quite a good advocacy tool. And I think one from Battle from Latin America was telling me the other day about how influential these RABs have been in Latin America region, where you can actually go to a decision maker, a minister, and say, look, this is the data for your country, even better, the state or province that you live in. So it's a way of engaging people and making it very personal and winning their hearts. So what we're trying to do is work with WHO and Hans Limburg. Hans is greatly involved in RABs, and we know all the RABs that have happened so far. We're compiling a list of RABs that you, the members, are planning to support. That's going to be available. We're working on it. It's work in progress. I'm going to send it round to everybody in the room after the meeting, and please do update it with the RABs that we already know you are supporting. And then what we will try and do is map that, what's already been done, what we know is going to be done, against some countries where we know it would be fantastic to have the data. So that's a key way of stimulating local interest. Another thing we've been talking to our colleagues about at WHO is development of an eye health service assessment. So to go into a country and to facilitate an assessment of the current eye health system, how it links with the overall health system, and what needs to be done to enhance services for people needing eye health. So this is a tool which is basically going to identify the current situation and the gap, what needs doing. This tool is going to be developed by WHO, and we imagine this is something we might like to hope will come out over a year's time, within the next year. But then you, the members, can play a vital role in taking this tool and helping get it used in countries, because it's actually a national level where people take this assessment tool, they do the assessment, everybody involved in eye health in that country is involved, others as well. It's a way of stimulating interest. And finally, another thing is a strong voice in country. And this again is down to members. Many of you work or live in these countries. You know the situation in that country. And one of the things we are going to talk to all our members about is how can you join together in a country as a single voice and really push and promote the implementation of this plan, meeting key decision makers and trying to single message implementation of the new global action plan in your country. Take it seriously. And I think that's all I had to say. So thank you very much for listening, and look forward to next year.